chê giống cô ngồi bên phía đó tới năm có
đầm bay lá mưa bọtของแห้งของดีวิโอลาแต้ระบบที่ทันดูสมองคน
Good morning, honorable guests, ladies and gentlemen. Once again, we would like to welcome your attendance to the Young Dentist Forum. We have celebrated the official opening of the 41st APDSA Congress and Young Dentist Forum since last night in the presence of His Excellency Dr. Mongkuthe. And this morning, I would like to introduce you to our chairman, Professor Law Hong Sai, and our co-chairman, Dr. Sok Jin Chien. Please give them a round of applause.
Thank you very much. The Science Institute of the Royal Cambodian Armed Forces. And today I understand there are students and graduates from the UHS, right? IU and UP. So give yourself a clap for coming over here to join us. The other partner in this conference is organized by the APDSA Graduate Club. Now, what is APDSA? Asian Pacific Dental Students Graduate Club. Jointly organized this for you. APDSA is an organization that started in 1968, and we're hosting our 41st conference, and I think it will go on for many good years. To start off the program, we have our first speaker, and it's only appropriate that we invite the most senior APDSA graduate to start off this program. And it's none other than Dr. Achiro Nakajima from Japan. Dr. Nakajima. Because I think he graduated person. So we hosted this APDSA conference in Cambodia. I said, you must come. You are our most senior alumni member. And he came. Let's give him a round of applause. And let's hear him on his lecture on future.
I'm very proud of here to be a first speaker of the guest speaker in your Young Dentist Association. And after 1968, we had a first meeting in Tokyo of APDSA, and we just 3 countries, in Singapore, and Thailand, and Japan. The total number of students was around 30, just 30. But that was the first step of APDSA a long time back to 1968. But I know you know
recognized last night. Dr. Sonnet, I still remember Dr. Sonnet was the first. He came here to Japan the first time. He was the only one delegate from Cambodia. Then next year, we expected how many students he will bring, but next year he came to APDSA 1. But now, yesterday, he did a great job. Thank you very much, Dr. Sonnet. Today, I'd like to speak about the future orthodontic strategy and tactics. It says the orthodontics, but actually, future dental strategy and tactics. And originally, this PowerPoint was prepared for Angle Society, keynote speech of Angle Society. It was held January 24th, California in this year. And maybe you know or not, but Dr. Angle, the name of Dr. Angle is the most famous orthodontist. Not only orthodontist, because he studied his school and the society before ADA. So before that American Dental Association, Angle Orthodontic Association was already established. So I was invited to the president of Angle Society of Northern California. And a year ago, I had a letter from him, and I need your presentation, the keynote speaker. So I didn't know the real meaning of keynote speaker, but he said, usually the lecture and the speech is about 1 hour. But he said, 7 hours. So I said, 7 hours? That a whole day. That's not a simple lecture. So the members is everybody have ADO, American Border Orthodontics, and some of them the examiner of ADO. So still they need some refreshment, re-establishment of their association and philosophy in dentistry. So I picked up consultation. Mainly this terminology has been used in physical treatment, not in dentistry. After stroke, everybody cannot move their body, hands or walk, even he cannot walk. So he tried to training. So PNF has been used more than 50 years for recovering of stroke. So today's topics, number 1, the PNF, number 2, mastication systems in dentistry and functional MRI. So the PNF stands for having to do with any of the sensory receptors that give information concerning movement and position
rehabilitation. It's making it easy. I take this word, Dr. Adler, Becker, Buck, and in the PNF in practice, spring of 2008. I'm one of the translators of this in Japan. So there are so many histories in the study from 1940. Now, the Part 1, Vallejo, California, then Kaiser Foundation Rehabilitation Center. Kaiser Rehabilitation Center is still in California. It's still doing teaching. And the course is, there are recognized training courses in many countries. Determination, the PNF is one of the tools which we can use in daily dental treatment for this purpose. I have been using this therapy for more than 50 years. So for example, the displacement of TMJ. So, what we're going to do for if we had such a kind of large TMJ person. It's nice. So look at this. This is one technique of cephrometrics. But the regular cephrometrics, you can use it very easily. Wide open cephrometrics. And the regular cephrometrics, it's very hard to see TMJ area. Because all steps, soft tissue, the hard tissue is all steps. So the condyle is moved forward, once condyle moves forward from the fossa. So you can see how much synchronize the condyle head and condyle neck. So this patient, T1, before PNF, you can see the large differences between the left and right condyle head and condyle neck. So this is the treatment after PNF, about 4 or 5 months. With a biotech, not only a PNF. So, can you see the differences between left and right middle slides? So, shift is this little shoulder smaller than the left side, and this is retention. Retention after 2 years. You see it? Almost the synchronized movement, but still have differences of, can you see it? This is the difference of condyle head shape, but this is the other condyle head shape. So that means the shape, the difference of shape of condyle, a different shape of condyle neck, is not so important. So the most important thing is the function. So next question is the function. What is the function? So we have to go into the real meaning of the function in dentistry. So also we can take PA cephrometrics. Usually, of course, you can you're taking a PA cephrometrics. Do you know the meaning of what stands for PA? Yeah, posterior anterior. So, how do you take the lateral cephrometrics? Lateral cephrometrics should be seated the left side of the film, or has been checked the whole Japanese university, 16 university and college, 90 out of 29 since last 12 years. But most of them, we have only 2 schools find out that they're taking cybernetics from the website. The rest of the university or college are taking cybernetics from the right side. Then I asked the faculty member, why don't you take, why you don't take your cybernetics from the right side? You should take cybernetics from the left side. But he said, even the professor said, oh, just the upside down. You can trace it, just turn it over. Turn it over, it looks like you can see the face on the right side. But the meaning is totally different. So this is a PA, she said. So we can see T1, time 1 before treatment, and a little bit, this is a nasal cavity, and the right side nasal cavity is almost blocked out. So this is soft tissues pushing to the opposite side for a long time. So actually, the occlusal plane, that means the middle of maxillary position is different, all pushing out like that. Then time 2, look at this space. So this patient can breathe equally, left and right nasal cavity. Then the interesting thing is you can see it. So this is the bottom of the nasal cavity. This is the bottom of nasal cavity. And even the bottom of the nasal cavity is almost the same. And then occlusal plane is going to be horizontal. Can you hear? Yeah. So next, we haven't had many years. We suspected that has a very interactive connection with our muscles with the central nervous system. That means the brain. But we have to examine using by EMG or MKG, but just the tool. So this is the recently functional MRI has been using for the relationship with the peripheral muscle to the central nervous system. Functional magnetic resonance imaging study. Blood oxygenation level dependent functional magnetic resonance imaging is known to be a non-invasive technique for studying human brain function. So this is the research done by Kawakubo. She's the graduate student of Tokyo Medical Dental University. Taught by Professor Ono and Moriyama. And the topic's name is the effect of follicular activations and the enhancement of the hand grip force during the teeth clenching on a function MRI study. So, published in, this is already published, but he gave to this PowerPoint is during the interest neuro research. Well, this is very difficult, but for example, so if you grip very hard and clench like this, so nervous system, the neural part of the brain is also active. That is the research. But still, this is very even the patient didn't gripping. The maximum clenching is still has a high score. This is interesting. And the same thing when we can take a look at the side of the brain function. So in the horizontal section, so we have looked at the same place. So also this is the different place, but every part is higher. You can see the higher with the interactive connection with our peripheral part of muscles function. So it's the same thing in the mastication and dentistry. So this diagram I took about Nakamura, Professor Nakamura, and he said this is very easy to understanding. But this was done many years ago before we have a functional MRI. Of course, Professor Nakamura. And here, effect organ subsystem. Here, sensory organ subsystems. The effect organ subsystem contains teeth, jaws, TMJ, muscles. So we call them together effect organ subsystems. Then sensory organ subsystems, the proprioceptor, muscle spine, periodontal ligament. Then should be this signal to the sensory nerve to brain, central nervous system, and transfer to motor neuron and go back to the these muscles. Then we can move it, right? So the terminology of the dentistry mastication is one of the important purposes of clinical dentistry is to send the signals to the brain via sensory organs distributed throughout the entire body. Elicit appropriate orders from the brain to the muscles and induce necessary and adequate muscle function. This is the same thing in orthodontics. Nowadays, orthodontics is easier and more simpler. Straight wire is good, but and the white bracket, white wire is more simple, or even just the plastic, model or Invisalign is the most famous orthodontic apparatus in the world. just take the impression, then send the label, and come back and just use it. But nothing. So straight wire, wire bending, the meaning of wire bending is this: send a signal to the nervous system. Mr. Susak and I wrote wire bending manuals. The name is wire bending manual many years ago, more than 25 years ago. It wasn't itself. But recently, 5 years and a couple years ago, translated to English and then studied from since U.S. Then started growing up all over the world. And now about 6 or 7 languages has appeared in all over the world. And one of the English version is you can see outside of this lecture. So if you have a time, just take a look. And how do regular dental treatments function in the mastication system? So probably we are doing every day restorative dentistry and periodontal treatment, orthodontics, many kind of orthodontics, and implant orthodontics, aesthetic dentistry. So may have some more, But these our dental work just going to here. So if you treat the patient periodontal membrane and the crown bridge and orthodontics, just a shake, nothing meaning to send the signal onto the sensor or nervous system. So if we have aesthetics, good result in aesthetics, and if we have a good result, aesthetic result by orthodontic treatment, but the main purpose of dentistry, not aim. So that means our dental treatment only for polishing and restoring. So I saw yesterday very fancy potion moving in the road in Cambodia. But even if outside it's very shiny and everything is okay and the engine is still, but if they don't have a UPS, it's not move. So just a huge product model. So the same thing we are doing, have been many years doing making a product model, a very fancy product model. Triumph in the dentistry away from the repairing tools and the focus in facilitating functions. So we have to go over from repairing to facilitating functions. We should have something new to break through of just the function. So do we have any method to send signal from the effect organs to CNS in our daily dental treatment techniques? just like iPhone or something. Do you think what kind of tools we have to send a signal to CNS from a fancy crown bridge, a fancy implant? Implant, that's a material, nothing. They don't have any periodontal membrane. Other words, because implantology or implant treatment should be careful more than normal crown bridge treatment because they don't have a sensor, right? Of course, periodontal membrane is not only a sensor of peripheral or sensory nerve, but other, we have another sensory nerve, but main sensory nerve is in the periodontal membrane. Yes, we have. SPNF. Then what is PNF and how to use it? So to sum up, we learned our dental treatment work connected to CNS function should be connected, or if you did the down treatment, still send a down signal to the CNS, right? So let's go into the little bit concerning about the PNF and body balance. So take a look at this is 18 years girl before treatment, facial photo, and usually we don't care about this kind of body balance and the neck balance, just here, mainly. But why we have to? She had such a kind of a imbalance, so we have to take a look at the whole body. So it's the easy tool or method to find out if she had a balanced or imbalanced. Can you see it? The distance between the right side and left side with the collar and the neck. The right side is longer than the left side. And the center of the shirt is off. The shirt is not off. Her head position is off, right? So, and this is the back view of her back, and the left shoulder is lower than the right side, and this is also shifting. So, this is intro photo, and this is center of the upper incisors, lower incisors, and this is another view of intro photo. So of course, we do regular orthodontic treatment plus. This is the Dr. Yanagisawa. He is the first guy who brought PNF technique from California 40 years ago. And I wanted to come here, invited him to treat my patient with regular orthodontic treatment. And he's doing. This is the PNF. I took this illustration from PNF book. So this book also published from Quintessence, but problem is Japanese, not in the English. So this is the just the result of before treatment and after treatment. Look at this center in Fuji. This is retention after 7 years. Of course, this is I did the regular orthodontic treatment last year now. Then this is the before treatment. This is after. This is retention 7 years. Look at this shoulder and neck. The tip of the shoulder is shifted, almost horizontal level, and still keeping his body balanced. So, she already also still has a good smile and in the body. So we cannot control total balance, facial balance, only for treatment in periodontal tissue and prosthodontics. Of course, it's important, and it's very important. But also, you have to think about why this patient has got so much trouble. And also, I didn't have any tool to examine the result and to make a VTO. VTO, or the term of VTO, maybe you are not unfamiliar word. Visual treatment objectives. So before you start your treatment, you should know your determination, your destination, where that is our goal, right? Because ideal goal, of course we have ideal goals, but not everybody can get the ideal goals. So we have to set up the real ideal goal we should go. This patient, right? So this is just the EMG and MKG, and the retention has a good result, still keeping the good result. Also, including total balance, we have to think about the cervical vertebra, because our human beings start to walk by 2 foot from the full foot. So we have to push up our head on the top of our body. So something needs to equilibrate to maintain the body. So maybe every cephalometrics, you can see you have a cervical vertebra. How many cervical vertebrae we have? Jen? 7? Cervical vertebra. 7? Good. Wait, how many cervical vertebrae the zebra has? You're not sure? Zebra has also 7 vertical vertebrae. So all human mammal has a 7. So even a long neck and short neck is the same. That's a joke. That's not true, but interesting. And this is a case with circumvention and regular driving class 2 and 8 years 3 months. This is the time 2, 14 2 months. Look at her quick back, and his head position is forward, like chimpanzee. Then, of course, we are mainly treating in the mouth, right? But we should think of a total body. For why he is standing like that? Because standing is something benefit, to take a look at the more long distance, and instead of the fourth, please forward first. And this is the time 2. So look at how the perpendicular of the ground, and his head position is a little bit backward. So this is the vertical vertebra and before and after. She got D5, he got a D5. He had to, get more air. So he wants to move head position to get more air. Then this is the time 2. So I'm using this kind of analysis for cervical vertebra. So these kind of axis and angles, then so we can see it normal and should be treated. The importance of facial balance in orthodontics. Orthodontic alone is nearly not enough to serve the practical needs for the patient. So you can change this word orthodontics instead of orthodontics to dentistry. It's the same thing, right? Jim, do you think? How about you? Yeah, I think so. So this is very fancy illustration brought by then by Quintessence, this book to 2011. Fancy. If the very beautiful lady still in underneath of the skin, of course, this balance, facial balance is good. So skin balance is good. So always we have to think about not only the teeth, the facial balance. That means the facial muscles balance, right? The facial muscles, nerves or balance. So this is another case focused to the facial balance. This patient is 18 years. 18 years, 5 months. So this is, of course, she got very crowded teeth and extraction case, non-extraction case. It's not enough. Used to be okay, but this is not enough right from now in future. Right? Today's title is contemporary and what? I forgot. Yeah, and beyond. So, words is easy, but we should have something, a reality to beyond, right?
Yeah.
So this is the one of the beyond message from Cambodia. So she had asymmetrical facial balance, and can the pendant here? Did you see it? It's a pendant. Pendant is always perpendicular to the gravity, kissing to the earth, right? Gravity, like this. So her face is off to the gravity line. So if we could, we better to try to turn it around to this circle during the treatment. Then this is the T2 orthodontic result and the facial balance. Look at this, the pendant perpendicular to the earth, gravity. So that means she can standing is perpendicular to the gravity, right? This is the center facial line, but also you can say gravity line. Can you see it? Understand? So how do we apply PNF in the daily treatment? So this is one of the shoulder adjustment, posterior depression down here, and she had a little bit off shoulder horizontal line. This is one time in here. So PNF is different from massage. So this it's easy. It makes it easy to change the Shin software and the iPhone, so you can use it from now, right? So massage is polish. So PNF is changing the Shin of the iPhone, right? Didn't you see it?
Yeah.
So that's the difference. That's one time you can do it. Because if you pull out the socket, turn it off easy, it's about if you put it on, that's on. That's the same thing. And anterior of the TMD problem, and put the index, the thumb, fingers on the upper part of the chin, give the resistance to the posterior. So there's a resistance. And the posterior, put the index, middle fingers on the lower part of the chin, give the resistance to the anterior. Well, this is a lateral shift. For the especially PNF to the lateral pterygoid, many problems caused by the lateral pterygoid. So if you got the TMD problem, so not for using the target, and before that, you should equivalent with of muscle and nerve. So if we had enough time, here is the demonstration time, but we don't have enough time, so this So EMG and NKG and biotemplate. So regular EMG and before and after. This is the before and after NKG. And this is very important. Biotemplate. So it looks regular resin type template. But Dr. Ricketts, have you ever heard about the name of Dr. Ricketts? He already passed away, and is one of my teachers, Robert Mary Ricketts. And I think he's one of the genius of the doctors. Genius scientist, and he gave us many lights to the future dentistry. So this is one of it. Objectives: intercept proprioceptive nervous system. Okay. So our first step in dentistry is to correct the software in each patient software in CNF. So before one of the tools to correct the CNS SHIM card intercept proprioceptive nervous systems. So when you taking a bite, rest position, try to have a patient say Boston. So, or the English-speaking person can speak Boston, but I try to Japanese Boston. So no space between the molars. So Boston, you can do it. Cambodian people can speak English very well. And this is a result of the height of the biotemplate. So it depends on the patient. So we cannot say that anterior distance is 3 millimeters, 4 millimeters, 2 millimeters, or one rare of south in a pink glass. It's not enough. So don't ask to the patient to or just rest the position. So this is the result case presentation. To sum up, the main role of the biotemplate is to cut off the input signal from the sensory organs. So he said, it's already finished my time, so I have to quit this slide. Thank you very much.
Thank you, Dr. Najima. I know it's a very big track, right? Mouth, pharynx, esophagus, stomach, and so on. The masticatory apparatus, the same. It's part of the older neuroskeletal system of the whole body. So all those slides and pictures you see, and the science behind it is you have to correct totality. In other words, the mouth is part of the health of the body. The neuromuscular system of the oral environment is part of the skeletal system. You can collaborate or you can disengage. If you have problems with the total system, you can disengage them or you can assist, so that eventually the oral apparatus, the dentition, the posturing, all is in harmony with the neuromuscular system. Am I correct, Doctor? Thank you. So it is often that we don't think beyond, and I think there are some very good slides in Dr. Narajima's lecture that we should think beyond. And dentistry must be practiced in that manner. Not just everything inside the mouth, we're all looking at the rest of the body and the functional or the dysfunction of those neuromuscular system. Alright, may I know if there's any question that you may have? Alright.
And the reason why I skipped the performance of PNF, it actually takes about 2 days. So if you have a time, please invite me for showing how to use it.
There's another question here from our co-chairman.
It's about the treatment between a growing patient and the patient who stopped growing to treat for a PNF. Is there any significant difference between this patient?
The patient has a memory when he or she had a dentist. So, when you treat the dentistry patient, you have to think about the memory of she or his young age. Then you can find out the mindset or neurological terminology is engram. The engram is the most important purpose to talk with a dentist. So it's the same, young age, older age, potential stages.
Thank you.
Started from as a teacher. In fact, as far back as 1987, when I was in NUS, which is in Singapore, that I wasn't get into dentistry as my first choice. Alright, so I wanted to do medicine, and then I did not get dentistry, and then I went to see the dean, Professor Low. I told him that I want to be a dentist. Yeah, and then at that time he was the dean. So then he looked into me into the eye and said, "Are you sure you want to be a dentist?" I said, "Yes, positively." Then he said, "Okay, I'll do something about it." And in the same afternoon, I received a call from the university registrar to say that, "Oh, you're admitted to dentistry." Okay, so I owe it to Professor Low, because if not for Professor Low, I'll be the medical doctor right now. I'm not a dentist. Alright, so therefore, the reason I'm here is because of Professor Low. I'm so proud that today he also will be the same guy who is introducing me here in this forum. Now, talking about APDSA, first of all, I want to go back to APDSA Bali, which was last year in Indonesia. And so, now, we just heard our eminent speaker here, Nakajima, professor, and then do you know that he's one of the founders for APDSA? And way back in 1967, during the 14th IADS meeting. Alright, so on to now today the strength, and you see our organizing chairman, Professor Hong Somet is here, and then and during the dinner table. Alright, so in the table here, then we saw some of my what we call super senior gentlemen. In Singapore, this is the term that we use to address our so-called, not our ancestors, this is our senior gents, our seniors, right? Okay, Dr. Seng Eng Kim and Dr. Rana Mason. So both of them were graduated from Singapore, and then one has gone back to Malaysia, which is Dr. Ranganathan, now is Professor Dr. Ranganathan, and also Dr. Sinminki here. So looking at the picture, they were so young and handsome. And then now you look at currently, they are equally young and handsome, but age has actually taken its toll on their face also. So I'm just hoping that in maybe another 20 years time, right, when my picture's up there, right, then I'll probably imagine how old I am. Okay, but what is important to see is that, right, in an old man's face is that you see in their eye, this the youthfulness, is the energy, right? It's vibrant with a lot of light and energy. So this is a difference in people who has a lot of purpose in life and who has so much energy, so much to share with people in life that they never age. Alright? And this is something that we respect the people from student age until today. They have not only grown to be a leader of the society, leader of the dental profession, but also during student age, they were also a leader. So all of you who are dental student leader right now, one day you will find that you are also going to be on stage here, speaking here and leading the profession. Okay, so now what I'd like to highlight to you here is that in 1988 in Taiwan, this is where my relationship with APDSA started. And that time I was actually the first year dental student. But before that, just wanted to share with you that the founding members of APDSA was Japan, Indonesia, Thailand, Malaysia, and Singapore. And I'm particularly proud of Malaysia and Singapore because in 1988 I was actually a dental student in National University of Singapore, and I am a Malaysian. And currently I'm also speaking as a Malaysian here, but wearing the hats of Singapore. Alright, so therefore I have also dual nationality here. But in fact I would say that I'm also a Cambodian because I'm no stranger here. So living this global village here, we find that we are actually a global citizen. So we are multi-nationality. It really does not matter where you come from. But then these 5 countries were the founding members of the APDSA, thus as warm of heart, and then we always recognize them as a founding member. And incidentally, they are also very active member, not only just in APDSA, but also in the professional organization. Okay, going back to 1988 again, there was during the 16th APDS Congress in Taiwan. And that time I was actually a first year dental student. So if you look into this brochure here, our Professor Loh that time was a dean, and he's also very young and handsome, right? and he's still very young and handsome. And during the time, Professor Loh, right, has a lot of young followers, you know, a lot of secret admirers. I still remember that the time he lectured on orthodontic surgery, and I was very much motivated by him, by his lecture, because he managed to show that how he changed the face of the patient and how he changed the destiny of a person after going through the orthodontic surgery. And at that point in time, I told myself that one day I'm going to be someone who also changed people's life and changed people's face also. And for that, I chose the profession as an orthodontist, right? But also, tributes to Professor Stephen Loh is that, right? Because of my passions in dental facial changes, I also took up oral maxillofacial surgery when I was in UK. So therefore, I'm also an oral surgeon. So that's right. I can do both orthodontic surgery as well as orthodontics. Right. So if you see this guy here, this small guy here, and then so this is me. Okay. And you also can see that age has taken its toll on my face also. Right, so therefore, way in 1988, that was me, alright, looking very so-called serious, alright, okay. I actually like to use the word handsome, but I thought it shouldn't come from my mouth, okay. It should come from one of the ladies there, right? Okay, alright, so, and I also disclose my age also, alright. Okay, so now what you see here in this picture is that, right, this was actually in the year 2012, when I was actually the president of Malaysian Dental Association. So I was invited to Taiwan again, and during the time, we actually established a sisterhood organization with National Taiwan Dental Association as well as Taipei Dental Association. So what I want to highlight to you is that, right, the friendship dated since 1988 actually bear its fruits in 2012. Alright, when I was the president of Malaysian Dental Association, and this gentleman here was actually my so-called my friends that I knew during the APDSA. He was a third-year dental student, and he also became the president of Taiwan Dental Association. So both of us, because we are very good friends, and therefore we also made our organization a sister organization. But somehow I don't understand is that when man and man we call ourselves brother, how come an organization we have called it sister organization but not brother organization? You see, even though both presidents are male, but we still have to call it sister organization, right? Okay, so if you like to take away, it's a bit unfair, isn't it? But I think that it's actually due to our men's respect for women. Alright, okay, so therefore tribute to all the women that who has actually mothered the growth of the association. Alright, so okay, along in these pictures here, you can see that these are the students' days that we have our meeting, and then these four people here. Okay, Professor Low was here, and this is me. Alright, so we were wearing our dental student t-shirt, alright, and then we were singing the Taiwanese song called APDSA Cambodia. Okay, and I understand that a lot of delegations here they are from Taiwan. Next year is going to be Taiwan, so I'm sure you are well versed of APDSA Cambodia, right? Okay, so the time Professor Low was leading us to sing the song, and we remember that there were four of us from Singapore. So we sang the loudest among all. Alright, so therefore that shows the spirit. Singapore is small, but Singapore cannot be bullied, has never been intimidated by the big crowd of people. So we are the loudest in the group. Alright, so this is part of the Congress manual here. Yeah, and we really have a very, very good time in Taipei. And I understand that next year will be Taipei again, so I look forward to go to Taiwan again to continue my memories that dated back since 1988. And along which, right, we also invited our friends here too, and then I've invited him to come to Malaysia during the APDSA conference, and this is him and as a speaker, and he's also an orthodontist. And so also you will find that the leaders here, right, Dr. Lee Ping Ken, now Lee Ping Ken, he was then the president of the Dental Student Association, and now he is also an orthodontist. Alright, and Dr. Lee, this Lee Boon Seong, okay, now Lee Boon Hien, sorry, he is right now a very successful private practitioner in Singapore. So you see that what we would like to share with you, the students here, is that right, during your student day is probably the most precious and most memorable moments. And usually the friends that you make in this conference, they could be your long-lasting friends in life. And then you will find that 10, 20 years later, they are all emerged as a dental leaders in the profession. And you will still meet them again. But they are all working very hard in this organization of the event. And also thank them for inviting me as a speaker. Right. So Cambodia is also home to me because I have been here for 10 years. Right. Since 2004, when I was first here, I was invited as an advanced speaker. Then subsequently, I conducted orthodontic courses here, and now I think I have many students here also that we actually learn and grow together with all of you. And so I really want to say thank you very much, Cambodia, and I really feel proud of you that I'm standing in front of you. Right, okay, and I also captured some of these pictures that I can see that you all have a lot of fun. You know, I stole it from Facebook, you know. So it looked as if I was here, right, but actually I wasn't. So I was actually stealing it from Facebook, and now this is me. This one is not stolen from Facebook. Okay, so just want to talk a little bit about my practice here. Yeah, so my practice is called Imperial Dental Specialist Center. And we have an auditorium here also. And so just to share with you our doctors and our facilities here. We are actually a patient-centered practice. When I say patient-centered practice, meaning that customer is always right. Customer is always at the heart of our center here. This is how we approach our practice, and this is our team here. And so we are actually situated in Bangsa in Kuala Lumpur, and this is how the clinic outlook is like. So we have about 2 shop lofts joining together, occupying a total square area of about 15.